let's talk laser hair removal, a popular treatment for hair removal. It is one of the most safe and effective forms for permanent hair production. And so the way that laser works is that we have the laser light being absorbed into the chromophore. And so this chromophore, we'll just say it's our target, and it's melanin. And so melanin is pigment. And so we have two types of melanin. We have eumelanin, which is what we're hoping to, create that selective damage of, which is that brown-black pigment that we see in the hair follicle. And then we have our eumelanin, which is more responsible for that red type of hair that we see, which is not going to work quite as well with the laser, if at all. And so what actually happens is that the laser light selectively damages that hair follicle whilst preserving the surrounding skin. So you can actually be, rest assured and be certain that the hair follicle is what's going to be treated, and the rest of the skin is actually going to be kept intact. So what's actually happening is if the correct sort of treatment parameters, so the correct settings, the correct intensity, and all that, fancy stuff that, we put in, will actually create what we call heat into the hair follicle. So the light absorbs into that hair follicle, it heats it up, so it's creating a thermal damage, and it's kind of destructing that hair follicle. So it's creating that reduction that we want. And so when it comes to hair removal, we're trying to catch the hair in what we call an active stage of growth. And so this is called anagen. And so in anagen, we've got lots of pigment being produced in the hair follicle. We've got, a blood supply, we've got stem cells. So we can see it's actively growing. It's got a big, thick, juicy bulb at the bottom of it, which is perfect for us to come in and sort of heat up and destroy. Whereas when we go through the rest of the cycles of hair growth, we don't have as much pigment, there's no blood supply, there's no, stem cells being produced. So therefore it's not actively growing, so therefore we're not actually going to create any reduction at all. And so the amount of hairs that are in anagen sort of varies, body site, but we're sort of able to, get a gauge for it when the hair starts to come back through after treatment. But there's no definitive way to sort of indicate, exactly, how long this is in anagen for, and what's actively growing per time. But as a general rule, we can sort of say, the hair on our head grows a lot quicker and is actively growing for a lot longer than, on our underarms or our bikini or our legs. It all varies from body site to body site and individual as well. We do have hormonal factors and other things that go into, our hair growth and what can actually cause hair growth. So therefore, the laser is a very sort of individualistic thing. So you can't be like, that's definitely growing, or you're definitely going to get a result, at this amount of time, because it really varies person to person. And so what we actually take into consideration when you come in for your laser treatment. So we'll get you in, we'll have a consultation, and in this consultation, we'll sit you down, explain exactly what's going to happen, in terms of, the laser being selectively, uptaken into that hair follicle. And we're also going to look at, any medications, any hormonal factors that can actually drive the hair. So some people find with polycystic ovaries or any hormonal conditions that they actually get an increase in hair growth. And that's just hormonally driven. And so we can actually, help to manage that and just make it a bit more comfortable for them during this period. And also during this consultation, we'll ask you a series of questions. And they might seem a bit random, and you might be thinking, oh, why do these matter? Why are these relevant? But it just helps us gauge exactly what we're going to do with the laser in terms of, settings and, your treatment plan. Because we don't want to treat, everyone the same. We want to make sure that we're customizing it per each person. And the best way to do that is to get an idea of, the medical history, any hormonal factors, but also, your genetics, like your skin type. And this is coming down to your heritage. So personally, I'm a very fair skin. I've got that English-Irish heritage. So you can easily, increase the settings a lot higher because I don't have any, pigment in my skin surface, no melanin in my sort of epidermal layer, which is that top layer of the skin. Whereas our darker skin types, say like the Middle Easterns, the Indians, the Sri Lankan skin types, they obviously have a lot more melanin in that upper layer of the skin. So that can also come into, you know, what we have to do with the settings. We just need to be a bit more cautious because it's melanin, laser lacks melanin, so sometimes it can get a bit confused and go for that skin melanin. So to ensure that, you know, we are getting you that effective treatment and a safe treatment, we just put it all into consideration. So we ask, you know, what's your heritage going back before Australia? What happens to your skin when you go in the sun? What happens to your skin when you burn yourself? So that way we can just see, you know, are there any risk factors that we need to manage just to, you know, make sure that everything is customized to you. In terms of what you can expect during the treatment in terms of pain, look, it's heat, so it's going to feel a bit warm. Your initial sessions and settings are quite comfortable. You might feel a bit of a flick here and there, but it's nothing really too major. Sometimes, you know, it can just get a bit itchy afterwards. But we do recommend popping on a post-laser cream, which we do have available in the clinic for you to go home with, and just keeping it cool. So no exercising, no hot showers. Warm showers, warm baths are fine, but just no hot showers because it's going to irritate, it's going to sting. Don't put yourself through more discomfort than you need to. It's a good idea to just pop on some loose clothing, sit down, have a lazy night, have a lazy day type thing. But definitely no exercise. We don't want sweat and bacteria and everything just entering into a freshly lasered area. It's just not a good combination. No exfoliating for at least 5 days, but when you do exfoliate at that 5-day mark, it'll be good because it actually just encourages that hair follicles to shed. It also helps prevent any ingrown hairs, so we're making sure that hair follicle isn't getting trapped in the skin. Sun exposure is a big thing before and after treatment. So if you are sunburned or if you're being sun exposed, it is not safe to treat. We don't know, you know, the extent of the damage in the skin from this sun. It's not a good combination. So what we encourage is 2 weeks after sun exposure is when you can come in to have your laser session, provided you haven't burnt, provided you haven't tanned. If you have burnt, if you have tanned, the time after sun exposure might actually be longer before you actually come in and see us in clinic for a laser treatment. So we'll bring you in and we will assess you. If we think that, you know, the skin's too tan or we think that it's, you know, too sun exposed, we will send you away and rebook you for another 4 weeks depending on, you know, the severity of the actual sun exposure in the skin. After a laser session, no sun exposure as well. At least for a week or 2. I would encourage you to exhibit sun smart behaviors. I'm not saying avoid, you know, going outside, but I'm just saying, you know, put a hat on, wear protective clothing, put sunscreen on, a 50+ and reapply. Just, you know, sun smart behaviors that we should be doing anyway in Australia. Given the type of climate that we live in and how harsh our sun is, we should always be protecting our skin anyway. But just in case, you know, we aren't, these are the measures that we do need to take, especially post laser treatment, just to make sure that, you know, we can continually get you the results you want and follow the treatment plan that we have made for you. Your laser sessions in space will be from your first session to your second session for a body part area. So not the face, like say for like your underarms, your stomach, your legs. These will be 6 weeks apart initially. So from your first to your second session, this will be 6 weeks. And then from your second to your third session, it may also be, you know, 6 weeks. Once we start to see that there's a slow in the growth, there's a reduction in place, we'll start to push it out. So from 6 weeks, we'll go to 8 weeks. From 8 weeks, we'll go to 10 weeks. From 10 weeks, we'll go to 12 weeks, and so on and so forth, just until we get you to at least a reduction of once a year or 70%. You know, most of the hair follicles have gone, they're not coming back, they're not bothering you. So most people find they get at least once a year, twice a year before they need to come in and just get a little top up because they're getting a couple of new hair follicles coming through. But that of course will vary. With the face, we'll do it every 4 weeks to begin with, just because it is a bit more hormonally driven, and it does come back a little bit quicker than the rest of the body. And that's got to do with how long it's actively growing for and the cycles of growth as well. So from the fourth week session, it will go from, you know, 6 weeks to 8 weeks and so forth again. and then the post-care remains the same. Eventually they will even up, but you'll still, end up with that result of, once or twice a year before you need to come in again, or overall a reduction of 70%. And our laser pricing is actually quite affordable, surprisingly, given the qualifications of our staff. I have my bachelor's in dermal science, so it means I'm equipped to manage any sort of adverse effects, because they do happen, but it's all about how we manage them and keep it safe. We do have doctors on site who can easily manage any adverse effect as well, but it's just important that you follow the before and after care, just to make sure that we're doing everything we can to make sure that you're having the good results, and making sure that we're not getting infections and anything nasty happening. If you want to book in for a consultation, you can always see us at reception. You can give us a call on 8555 3855, or you can message us online. We have a website, providermedicalclinic.com.au. You can easily look us up and book online. Otherwise, we're on Facebook and Instagram, Provider Skin and Medical Clinic and Provider Skin Clinic. Thank you.